People think nursing is just giving injection and medicines, but what people don't see behind that uniform, there is a person who sacrifices sleep, mental peace, physical energy, and sometimes their own health while saving someone else's life. So, here in this video, I'm discussing about 5 truths that nobody tells you about nursing. The first thing is the biggest stereotype about nursing is nurses only give the injection. No, injection is just a tiny part of nursing. Nurses involved in the patient care from admission to the discharge. Nurses monitor the vital signs, provide the medications, give the injection, provide emotional support, educate the patient, and prevent the patient from the infection and assess the complication of the patient. Nurses manage the emergencies, nurses assist the doctors, and nurses provide the holistic care. Holistic care does not only mean the physical care but also caring the patient emotionally, spiritually, and mentally. Sometimes patient does not heal because of the medicines only, but also someone helped them when they were helpless. The second thing is nurses risk their own health. One needle stick injury, one infection exposure, and one mistake during the emergency risks their own health. That's why PPE is not optional but it's a protection, whether it's wearing a mask, whether it's wearing a gloves or it's a gown. During the outbreaks, pandemics, emergency situation, critical situations, nurses keep working but many people stay inside home safely. Nurses care for the patient when they are physically exhausted, emotionally stressed or afraid because in healthcare the responsibility is not paused. The third thing is there is no normal routine. People say just manage your time, but nursing does not always follow the normal routine. Night duties, emergency calls, sudden patient deterioration, long shifts, interrupted meal, interrupted sleep. Sometimes nurses work while their own body is tired beyond the limit. Birthdays are missed, festivals are missed, their sleep schedule is destroyed, and still the next patient needs care. Healthcare never stops, so the nurses always cannot stop either. And the fourth thing is emotional pain is part of nursing. One of the hardest part in nursing is not physical pain, but it's emotional pain. Every day we see the patient suffering, families crying. Every day we see the loss, trauma, helplessness, almost every single day. Even after seeing all this, we still have to stay calm. We still need to support the patient and work professionally. Sometimes nurses cry silently after the duty hours. Sometimes they carry the patient stories in their head for a long time. Nurses are trained to stay strong, but they are human beings too. And the fifth thing is nursing is physically and mentally exhausting. Nursing is not easy profession. It demands the physical strength, mental focus, emotional control, communication skill, and quick decision making skill. Standing for long hours, handling critical situations, managing the emergencies, and calculating the medications doses carefully, responding quickly under the pressure. That's why nursing is not a simple work, it's a responsibility that requires the focus, discipline, education, humanity, every single day. So, next time when you see the nurses, please respect nurse because caring for the humanity is one of the toughest jobs in the world. And if you think you find something new in this video, then share it with someone who thinks nursing is just about the injection. Thank you.